So we're in the middle of a healthcare crisis. We need to up our game as well.
And until we have all of us working towards the same goals or similar goals, then I don't think we're going to be as strong as we could be, and I know that we can be.
We were going through a lot, so whether that's going through COVID and then changing around some of our program because of the responses that we've had to do in order just to keep our programming going, so there was a lot happening.
You even gave me this direction of, I want this to be different. But was there any fear around its differentness?
I think at the beginning, I went back. I looked at some other university, other plans in the university, and I thought, that's not what I want. I don't want this 30-page document, and that's my mandate. That gave me a huge amount of confidence. And I met with a few people who said, oh my gosh, that's exactly what we need.
I've always felt we've had a really good spirit of collaboration at the university, both within the faculty and really across faculties.
We had this massive strat plan that we did a lot with, we had a lot of success with, but we'd outgrown that model. And I want to create a plan that people aren't just going to roll their eyes and go, oh, we're never going to do that. Because I've seen it happen. Plans get delivered and it's like, oh yeah, that looks great, but oh yeah, I ain't doing that.
It's going to be great, I think, and it's going to be an opportunity for all of us to rally around it and really propel the faculty forward.
I can see how we could tie in our goals to the big picture, so I'm looking forward to that.
We're such a large faculty with a lot of diverse, schools and units and everything, but there's so much commonality as well. So that really came through in our discussion.
I think that's gonna work well, and especially when you have those kind of sessions involving different people, like staff, faculty, and different units. I think it's a good way to go.
I was incredibly impressed by the talent and the passion of your colleagues.
I think the amount of work that was accomplished in a short period of time is surprising. I think the quality of what we came up with as a team was not surprising, because just very passionate, very knowledgeable people that want to make this work, want this to be a success. I'm really excited about this, that we engage, we explore, and we educate to advance health. And that, to me, says that we're engaging both internally and externally with our partners. We're exploring, and to me that's the research, that's the students coming in and exploring themselves within the healthcare system. And then the educate. We are educating health professionals that will go out into practice. And all of those pieces help advance health.
It's had some discipline and structure, as well as allowed for some dialogue and process.
We're really identifying where we're going, but also really identifying who we are and what our purpose is.
So you now have your lighthouse. You're moving from planning into the doing of the work, the implementation. What do you think happens next?
Oh, that's where the work starts. And I think it's going to be empowering. It's going to give people direction and focus, and they can see how they're lighting the way.